COVID-19 is taking an especially heavy toll on African Americans.
So we recently Skyped with Michael Walker, PhD student at the University of Minnesota, one of our relationship gurus, to get his perspective on why this is happening. Thanks for joining us, Michael. You told us about a saying, when America gets a cold, the black community catches the flu. What do you mean by that?
Well, it's just that with all the disparities that happen in our society, especially right now with the COVID-19 situation, is that when America just is going through a tough time, it is even more tougher for the black community during that same exact time. The disparities are even worse.
Mm-hmm. And Michael, when we talk about this, there's so much of a range of issues that you could talk about. Everything from pre-existing conditions to the lack of equal treatment when you visit the doctor, to the lack or the unequal access to health care. Just start covering just the breadth of what we're talking about.
Yeah, well, I mean, when we're talking about how this is impacting the black community, I mean, there's a whole historical context that we have to bring to the forefront so we can even understand what's going on currently. You know, we talk about the lack of trust in the healthcare system. You know, we had a history where the Tuskegee experiment, where they were injecting our community members with syphilis and not giving them the proper treatment to see how the testing would go and what were some of the diagnostics and that sort of thing. So those things impact how we attest to the system now, right? We talk about the equal treatment when we attend doctor visits, right? There's research that shows that for black community members, when they go into the doctor, in order to get pain medication, they have to ask 4 to 5 times more than our white counterparts to get that same level of treatment for similar symptoms and pain.
Yeah, which is very troubling, and obviously in this situation where the symptoms are presenting in a way where you know, these are the symptoms for coronavirus are very similar to symptoms of a million other things. And so if you don't have that trust between the medical professionals and the person who says they're feeling ill, gosh, I mean, we've seen a couple instances of people who've died and haven't received the care that they were seeking.
Yeah, for sure. I mean, that speaks to just the, you know, the impact that it has on the black community, is that we have to be willing to go through many lengths just to try to get equal and equitable services, even when we're talking about health care. The other piece that we have to be mindful of is that these pre-existing concerns, right, these pre-existing issues that we are referring to.
What are we talking about here?
So as we're talking about hypertension, obesity, asthma, these things, again, are not just relegated to right now. It happened because, you know, there's things that happened due to redlining, where we were relegated to live in certain areas of the community, which then included factories were built there. And so now this exhaust that's being emitted into the atmosphere can have an impact on people's health. And now that creates what some of the things that we see now is asthma or hypertension and whatnot.
Another thing, Michael, too, it's not just people who are getting sick, but the potential for people to get sick. You look at essential workers and who are suffering disproportionately, who are residents of color. And you have to think, okay, they are out there, they are on the front lines for us, and they are suffering disproportionately as well.
Yeah, we have classified them as essential workers in this day and age right now, because they are the ones that are working in a lot of our service, you know, customer-facing service industries, where they're at the grocery stores, stocking shelves, where they are some of the people that are delivering the food from this business to that business in the trucking industry. And so now we see the value in that, but also the fact that they're day-to-day facing customers, that puts them at more risk of contracting the coronavirus. And so we have to think about that measure as well.
Let's talk about the future here, Michael, because it can be a little discouraging when you hear that this has been going on for so long. Is there a light at the end of this?
Well, we hope there's always light at the end of everything that's going on. So when we look towards the future, you know, one thing that I work in the field of education. And so right now we are, as educators, are working on distance learning. And so how are we being equitable to make sure that we are avoiding marginalization while we are having our students distance learn? Because we know that there are already disparities within our educational system just on a regular simple day. Now with this distance learning piece, there could be other ways that we can marginalize students. You know, for the simple fact of access to technology.
Sure.
We also have to be mindful that as we're talking about these essential workers, that students at home may now have to take on adult responsibility because their parents are out working in these customer-facing jobs where they're not at home to support their kids around distance learning. So if we want to make sure that we're changing these outcomes, we also have to make sure that we're educating our students properly so that in the future they have the opportunity to be in different professions and different careers so that they can have some say and some perspective on how we can avoid this in the future.
Right. We're already exposing some of the big cracks that were already in the system. Michael, we really appreciate you taking the time to talk about this really important issue. Thank you.
No, thank you very much. And I would just like to end with this one thing is that we will get through this. It's just that once we get through it, how are we going to show up on the other end is really important. How do we think through that?
And how do we learn? All right. Yeah. Thank you.